right, hello, Pewaukee School District community, and welcome to the latest edition of the Open Mic Podcast video format. This is the first podcast we've had since COVID. So congratulations to the three of you as my guests to be the first pandemic interview that we've had. So welcome. All right, so I'm going to introduce my esteemed panel today. I have Dr. Danielle Bosanic, who is our Chief Academic Officer. I have Colin Jacobs, who is our Director of Human Resources. And I have Liz Cassesi, our school nurse at Pewaukee High School. And so I thank all of you for being here today for this episode. And our goal today is really to talk about some of the materials that we're sending out to parents and really walk students and parents through how we're going to function in relation to trying to keep kids and staff safe during this pandemic when we're in school, and cover a variety of concepts from things like contact tracing and quarantine, which I know is heavily on people's minds, monitoring symptoms, and just to give people a real sense of the kinds of things that we've built into our plan to prepare for the return of students and keep everybody safe. So with that, we have questions assigned to everybody, and I'm going to start off with you, Colin. So Colin, you lead the district wellness team, and that includes our nurses and our medical advisor, and also staff members who are focused maybe more on the social emotional health side of things. You will also be serving as our primary contact with the county health department with Waukesha County. So can you describe for our viewers the role of the wellness team and give us a little bit of a summary of what the team has been focused on as we head into the school year?
Sure. And with the district having 6 teams really working in concert, the wellness team had a focus of 2 goal areas. We really wanted to focus on implementing systems that keep students and staff safe, obviously, as we return to campus, start our school year. And the other focus was really gathering as much information we could in terms of our procedures and strategies, and building them into our practice. So we reviewed guidelines from the CDC, DPI had guidance, as well as the Waukesha County Health Department. Other districts, we borrowed ideas, and we also relied on our own innovation. So in addition to those guidelines and strategies, we really had a data approach as well. So thank you all the Pewaukee families for the surveying through the summer, as well as our staff. So in looking at services like busing and lunch delivery, we really wanted to know the group sizes to make the best choices for our students and staff. And lastly, our health rooms will take on new importance this year. So we spent considerable time looking at our services, not only what health rooms regularly deliver, but also expanding that to meet all the needs that COVID represents in our buildings.
Well, thanks. All right, Liz, I'm off to you with the next question. You know, many people probably don't realize how fortunate we are and really unique with public schools that all of our schools are staffed by certified professional nurses. That is really not typical in most school systems. And we've never been more thankful for that than under the current circumstances. So can you tell us a little bit about the role our nurses will play as we work to manage issues related to the coronavirus when the school year resumes?
Well, really, the nurses are going to be on the front line. That's where we are in the health room. When the student comes to the health room, we're going to be the one who decides, is that student there because it's a COVID-related issue, or is it because of something else? If it's a COVID-related issue, we've now divided all of our health rooms into 2 separate rooms. So one room will be considered the regular health room, and the other room is going to be considered the isolation room. So we're going to be putting kids in 2 different places. In all 4 of our schools, there's 2 different places, okay, for these kids to go. If a kid is going with COVID-like symptoms, they will go into the isolation room. We will be calling parents, and that student will be going home. So we really are the front lines on that. And then we'll also be involved with the contact tracing for the county and working closely with Colin to make sure he has all the information he needs for the county and things like that.
Okay, great. Well, Colin, your team has looked extensively at the guidance from the CDC and the DHS, Department of Health Services, that you mentioned previously. You've done this as we've developed protocols and procedures to help us mitigate virus transmission in our schools. If you can, please walk us through some of the steps we are putting in place across the district to reduce the risk of COVID-19.
Well, first and foremost, it's a really wise approach for the phase one start to the year. So that just allows for that social distancing component to really be across all buildings, from our youngest learners to our oldest, in all content areas as well. So obviously, social distancing affects how we have bus systems, again, lunch delivery, and how our classrooms operate as well. So we're obviously an organization of learning, so we want to be teaching what the safest measures are, even from our youngest learners, how to hand wash, how to interact, without compromising our approach to learning as well. So social distancing will be important. Obviously, there'll be deep cleaning efforts that will look a little different than the way we normally clean our schools. So our operations team has been fantastic with not only getting supplies and access for all staff, but the execution of just cleaning our spaces regularly and in response if we have a student that has to leave, and making sure that area is cleaned up appropriately so the rest of our students and staff remain safe. Obviously, an emphasis on face coverings. We want to stay in compliance throughout the state. And our cohorting approach to our classrooms will really pay off. So not only social distancing, but especially at the 612 campus, keeping interactions from one class to the next and one student going from class to class to a minimum, so that when we do look back and see what interactions that student had, we can really gather the information for what interactions were either through the bus or through a class, and we've really minimized those throughout a student's school day. Finally, we're symptom monitoring as best we can. So we really rely on input from our staff for their symptoms, as well as we'll rely on that input from families as well. So we have responses in place in each school's office. So when that call comes in of, I think my child may be sick, we can respond accurately, as well as help families make a safe decision for their student before a school day even starts.
Yeah, and there's a couple of key points there I want to emphasize. When I've received communication from parents, one of their very understandable concerns with our model is childcare and the fact that we're not 5 days a week to start, and we recognize that's a real burden for families. But what you talked about, Colin, was just briefly describing the many kinds of protocols and procedures that our staff has to learn, that will be implemented for the first time ever, that our students will be exposed to for the first time ever, as no one's ever tried to do this before. We haven't had a pandemic of this nature in 100 years. So a very unique situation. And as you said, having this hybrid start where we can begin with fewer students, we believe, puts us in a much better position to troubleshoot those things, to refine them, improve them, and hope that they're working very well, and puts us in a better position so when we do increase student to fuller student attendance, that the system is running very well, so that we have a better chance of, as we say, stay safe to stay open. Because our goal is to keep our schools open, not just get them open for a week or two, but to put things in place so that we're able to stay open. So
yeah, and Mike, I wanted to mention real quick. I mentioned some really people-based systems, but even through the construction and the addition to our HVA system, a really air cleaning, purifying system that's going to really improve the learning environment. And again, with the focus on keeping students and staff safer, the addition there to each building's HVAC, we feel is really going to pay dividends as well.
Yeah, that was a decision that we made recently, and actually the construction really allowed us that opportunity to install that bipolar ionization plasma system that hospitals often use to help get rid of viruses and bacteria and mold and different other impurities in the air. So we're hoping that that system will be really beneficial for us to improve ventilation and to get rid of the virus. So, all right, Liz, I'm going to move back to you. We know our parents and our students are really going to be key in this, in supporting our ability to stay open. So what can parents and students do to help us stay safe to stay open?
Well, first of all, I think that if everyone wears masks, and socially distance and wash your hands, wash your hands, wash your hands all the time. Whenever you're outside of the home, this should be going on. If you can keep everyone in your home safe, then you're and not ill, you're going to send your child to school, and that your child's not going to bring illness to school. So we really need to be doing this not just during the school day, not just having the kids socially distance at school, wearing masks, washing their hands, but it really needs to be outside of school also. Because if our whole community comes together and does this, we will be successful at mitigating this virus. The other thing that is being recommended by the American Academy of Pediatrics is make sure that your child is up to date on their immunizations, and seriously consider giving your child a flu shot this year. The immunization rate went down with COVID because people couldn't get into their pediatricians. Well, pediatricians are welcoming people with open arms for catching up on your immunizations. So please go and make sure your child is up to date on immunizations.
Great. We talked a little bit about that symptom monitoring, and we just can't stress that enough for our parents that you must keep your kids home if they have virus-like symptoms. And we'll talk here shortly about Liz will talk a little bit more about monitoring for symptoms and why that's so important. So I'll turn it back over to you, Liz. But as we talked about those things, why is it so important that our parents keep their kids home if they have symptoms, and what are some of the symptoms that they should be watching for?
Okay, well, it's so important to keep your child home if they're sick because we want to stop the spread of the virus. And as everyone has heard from the news, children may just exhibit very mild symptoms or no symptoms at all. Obviously, if your child has no symptoms, we can't look at your child and say, oh yes, they have COVID. So we don't expect you to be able to do that. But we do want you to be monitoring for cough, shortness of breath or difficulty breathing, loss of taste or smell, fever and chills, headaches, body aches, nausea, vomiting, diarrhea, sore throats, and congestion and runny nose. So it really is a wide gamut of symptoms.
Yeah, and I've been on regular calls with Children's Hospital pediatricians, and they really stress that it's a virus, right? So it's going to have symptoms, and that's one of the things that's going to make this really challenging, especially as we do get into the flu season. That the symptoms are going to be the same that you would see for the flu. So
correct.
One of the issues that can be confusing for parents is the concept of quarantine and how that will work. I know I've had people ask me lots of questions about that, but how it'll work if a student has symptoms, or if a student is exposed to someone who is infected, or if a student is actually diagnosed as infected with COVID-19. So I'll look to both Colin and Liz on this one. Colin, if you could maybe talk about how we will be communicating with the county as we deal with this issue. And then Liz, maybe you could walk everybody through kind of that decision-making process and in terms of determining who gets quarantined and for how long.
Sure. So from our partnership with the county, the aspect is really, again, two main focus points. The first one is that the county does have a team specifically connected to work with our schools. So really the sharing of data in real time is very important, not only to monitor how the county is doing, but even smaller subsections of the county. So data is flowing from the school to the county and back in real time as each school day commences. The other part is really when we engage in contact tracing. We recognize our role as the schools is on the front lines to not only respond but gather data, help students and families take those next steps, and really make the right advice and give them the right information so they can proceed, and then partner with the county if there is testing that needs to happen. So sharing data and really sharing the information with families, then we recognize as schools we're right in the middle, and we want to stay on the same page with the community as well as the county health department.
Thanks. And Liz, again, over to you. Maybe walk through that process, what it looks like from that student perspective.
Okay, I just want to say that I understand why this is confusing to parents. I have been working on this all summer long, going to countless meetings with the state, the county, the Department of Public Instruction, and listening to webinars, etc. And I think I finally have my head wrapped around this whole concept for going back to school. So it is not easy to understand. And please, please ask your school nurse when you have questions, because I'm just going to run through one of the scenarios. That's why it's so confusing. There are so many different scenarios that could possibly put you into quarantine. But I'm going to give you one example. So Johnny and Susie have a play date on Monday. On Tuesday, Susie becomes ill and Susie's mom takes her to the doctor and gets a COVID test. The COVID test comes back positive. Now, when Johnny and Susie had their play date, they were not staying 6 feet apart. So they were not social distancing. So that makes Johnny a close contact of Susie. When you're a close contact of someone who tests positive for COVID, you are required to quarantine for 14 days from the last day that you've had contact with that person. So then Johnny will be in quarantine at that point for up to 14 days from the last time he saw Susie. So I hope that kind of explains it. That's one scenario for you.
Yeah, and so just to kind of extrapolate this out for parents and what this means in a school setting, right? So Colin talked about a strategy like cohorting, where we're trying not to have groups of students interact with each other. So you can imagine that sending or having one positive student in a classroom could potentially put that entire classroom into a 14-day quarantine, including the teacher. So the fewer people that individual students interact with, or staff members, frankly, interact with, reduces that circle of people who may be affected by a quarantine. So again, it emphasizes how important it is for parents to not send symptomatic kids to school. By doing so, you may shut down your child's entire classroom for a couple of weeks. If it's at a secondary level, those students are going to have multiple classes and potentially more exposures. There will be efforts in classrooms to keep that 6 feet of distance and less than 15 minutes, which is a cumulative amount of time. 15 minutes cumulative in any day within 6 feet would qualify someone as having an exposure, and they would have to be quarantined for 14 days. And Liz, correct me if I'm wrong, but a negative COVID test does not release someone from quarantine.
Correct. If you get a negative COVID test, all that's really telling you is on the day you took the test that you do not have COVID. The reason for the 14-day quarantine when you've been exposed to someone with COVID is because it could take up to 14 days to come down with the virus. By day 14, 97% of the people who are going to get sick get sick. So it's based on the statistics that they've gathered so far. So you could test on day 2 and come back negative. Maybe you even test on day 10 and come back negative. So that's why a negative test, if you have been exposed to someone who is positive for COVID, does not get you to come back to school any faster.
Yeah. So it's really important, I think, for parents to understand that there is a great potential that your child could end up in quarantine at some point this year. We hope not. And everything that we do, from the hand hygiene to the mask wearing and all those things will reduce the likelihood of infection and spread. So reduce the likelihood of not only getting sick, but ending up in a quarantine. The better that we are with those things, there will be less incidence of that. And also being conscientious outside of school. We can't control what families do and what kids do when they're not in our buildings. And so being conscientious about kind of the risks or the exposures that take place out of school will, again, help us stay open. Because if we get too much spread in a classroom, in a grade level in a building, it really engages a decision-making process where we have to consider maybe even broader shutdowns, and likely those would be for a minimum of that incubation period of 14 days. So again, our goal is to keep kids on campus as much as we can, so that in-person learning can take place, but that's going to require that we're able to manage the virus spread. So we know that when kids are quarantined, that they still we we need to facilitate their learning, and we refer to that in our reopening plan as emergency remote learning. So Dr. Bosanic, can you talk a little bit about what that looks like? And I know it's a little bit different.
Yeah, so it is a little bit different depending on the grade level of the student, and it also is dependent on some of the courses that a student may take at the secondary level. But generally speaking, if a student is in elementary school and they are going to be quarantined for 14 days, then they will move into the emergency remote learning plan, which will very likely shift them to one of our all virtual sections. We have a virtual section of students in all of our grade levels through K-8, or excuse me, K through 8. And so they'll likely shift in to that. They will still hand in all of their work to their regular teachers, but they may be interacting with a different teacher for some of the lesson delivery as well as some of the activities that they do. At the secondary level, so our middle and high school, depending on what their coursework is, they may engage in streaming in live to some of their classes, or engaging with the virtual sections that are happening as well. So it's pretty dependent on what their coursework is and what makes the most sense. So we'll be taking a look at each case individually and setting up a plan. It's important for parents to know that if their child is placed in quarantine, it's going to take up to 24 hours before we can start to engage them in emergency remote learning. Because again, we want to look at what their coursework is and what's the plan that makes the most sense for them. So for example, if their child is sent home from school and for COVID-like reasons on Monday afternoon, then we'll take Tuesday to set the plan in place. And on Wednesday, that student can be expected to start engaging in virtual learning. So the other thing to note is that obviously if a student is ill to a point where they cannot engage in learning, that we would be treating that the same as any other absence if they had anything else like in previous years that would keep them from being able to engage in their learning. So again, this would be the emergency remote learning would be for those students in quarantine who are well enough to engage in learning, but need to remain home because of that quarantine time period.
All right, so and that's something I think it's important for parents to understand is that we're going to make every effort to keep learning happening. We anticipate we're going to have COVID in our schools. It is a virus that will not respect boundaries of this campus, unfortunately, and just like there's no year we've been able to sail through and not have any cases of the flu or of colds or those kinds of things, this virus will affect students and it will affect staff members. We hope that we're hopeful that we can very much limit that with the things we're putting in place. Again, our partnership with our parents and our students is going to be critical with that. We believe we have good plans in place to try to manage that, but we certainly anticipate that kids will be, or many kids will be in and out of this environment. Obviously, we're starting in a hybrid, which has kids immediately in part in person and virtual, and others who have families have obviously selected to begin with the full virtual model. So our hope is that we're able to get to full regular attendance. We hope that it gets managed well and we're able to stay open, but all parents should be prepared for the fact that whether it's due to an exposure in your child's classroom, that there's potential that your kids will be home for a period of time, or whether we have significant spread in the community or in the school that happens despite our efforts, that a school or the district could go to phase 0, which would mean for a period of time, kids would be home. And I know this is not an easy piece to resolve, but really I would encourage all families to have a plan for that circumstance. So if you are told today that you need to come pick up your child and they're going to be home for 2 weeks, you should have a sense of what your strategy is going to be to manage that. And again, I don't say that lightly. I know that's a difficult and challenging thing for people depending on your circumstances, but it is a reality that everyone should be prepared for. So I want to thank my 3 guests today for providing your insight and expertise I want to thank all parents who've taken the time to listen and point out to you that really the information that we covered here is going to be provided in even greater detail in writing. So there should be some materials that have been sent home. This was meant to kind of go along with that. It includes a flow chart that walks you through the quarantining process, which, as Liz described, is complicated, but I do think that flow chart makes it much more understandable in terms of how that will work. And I'll let you know that following this podcast, I'll be doing another really talking about that decision-making process. Lots of parents have had questions about how will we decide on moving from phase to phase and those kinds of things. And so I have a document with an explanation of that that's going to be pushed out to families by Monday, and intend to include some video explanation and presentation of that, as well as I understand people want to know how that's going to work. So with that, thanks again, everybody, for joining me today, and have a great afternoon.